Evening and welcome to Education and Children's Services Scrutiny Committee on the 7th of December 2021. Housekeeping. As far as we are aware, there are no fire drills planned for this morning. However, if the continuous alarm sounds, leave the building by the staircase and assemble it in Arthur Street car park. Do not hesitate to gather personal belongings and do not use the lifts. Wait in the assembly point in the car park until the all clear has been given to return to the building. The committee is being webcast. Please, I am reminding you, members, to press the button carefully once on the microphone before speaking and switch it off as soon as you have finished. Mobile phones should be switched off as they may interfere with the webcasting equipment. So, welcome to viewers watching on the webcast and to members of the committee. Officers in attendance today and presenting are Dave Carr, Director of Policy, Commissioning and Children's Health, Fleur Carney, Director of Mental Health, Learning Disability and Autism, NHS, Lancashire and South Cumbria, Helen Rimmer, Services Redesign Manager, NHS, Midlands and Lancashire Commissioning Support Unit, David Keegan, Counselling Psychotherapist, Supervisor and Training for MBACP, and Marie Demain, Health Equality, Welfare and Partnerships. And then we've got our Youth Council, very welcome to them because their voice is so important, is May Reid Graham, Mariam Husseini, Amber from the Youth Council, along with Bradeen and Georgia. It does say on our papers that they are to observe, but I have given them permission to be able to speak and ask questions because I think it's really important young people speak. Item 1, apologies and replacements. We've had apologies from Simon Smith and Rupert Swarbrick. We've got replacements with Steve Rigby for Barry Yates and John Singleton for Ash Sutcliffe. Attending virtually, we should have Janet Hamid, not sure if she's on yet, and Sobia Malik. Welcome, Sobia. Item 2, disclosure of pecuniary and non-pecuniary interest. Members should be asked to consider any pecuniary or non-pecuniary interest that they may have to disclose to the meeting in relation to the matters under consideration on the agenda. It would be most helpful if I or you could declare to me any specific items in which you have an interest and the nature of the interest declared. Samara.
Hi, I run a national mental health programme in schools, so I'll probably not ask any questions on that section of this paper.
Are there any others? Sobia, have you got anything?
Yeah. Sorry, sorry.
We're on pecuniary interests. Have you got
yes,
anything?
Nothing to declare.
Brilliant, thank you. Item 3, minutes of the meeting on the 1st of September 21. Does anybody want to bring anything up? Are we happy with them? Does anybody want to propose the minutes? Anne, thank you. Ron, would you second them? Thank you. That they've been agreed as a correct record. Item 4, children, young people's mental health. This is going to be presented by introducing NHS data with Helen Rimmer and Fleur Carney doing the presentation, which will be online. Dave Carr will also represent the information with the NHS colleagues. Mental health support teams, which is David Keegan online, and the Youth Council will be May Reid, Marion and Amber. The recommendation is to consider the information presented, where necessary make recommendations to the relevant cabinet members, and to further support emotional well-being and health services for children and young people in Lancashire. We must remember it is only about the whole of Lancashire. It is not about anybody personal. So names must not be disclosed of anybody. It must be all about the area, about Lancashire on the questions. Thank you. Let's move on. Oh, the NHS going first? Are you on behind me?
Yep, thank you, Chair. I'll just share my screen. So thank you very much for inviting us here today to present to you around children's mental health services across Lancashire. As has just been mentioned, we've got an overview of what we'll be talking about today, presenting to you. So we'll talk about the mental health demand, early help and eating disorder services. We'll talk to you about our response to COVID-19. As the Chair's mentioned, the Youth Council have done a report on a study on mental health from the viewpoint of young people, which will be incorporated into this presentation. We'll also present to you the Lancashire Emotional Health in Schools and Colleges. Following that will be around the mental health support teams. We'll then talk to you about the transformation programme that's happening in children's mental health and our plans moving forward. So for mental health services, during COVID, all our providers continued to be responding to children and young people's mental health. They remained open and offered face-to-face appointments where appropriate, but also introduced a number of virtual appointments whilst children, young people and their families remained at home. The NHS's ambition, the national ambition, is for an increase in access to NHS-funded community services, which is to meet the needs of at least 35% of children and young people with a diagnosable mental health condition. As you can see from at the right of the screen, and the table shows that as a whole for Lancashire and South Cumbria, we actually achieved 55%, so that's a 20% increase on the national target. Now, with the increase in children being seen also comes with an increase in referrals being seen, and this has been attributed to children returning to school and also the impact that COVID has had on them. We're also with an increase in referrals being seen, there is an increase in waiting times, which are 3 providers, Blackpool Teaching Hospitals, Lancashire and South Cumbria NHS Foundation Trust and East Lancs Hospital Trust are responding to. There's going to be some new national waiting times coming in the new year for children and young people to be able to be seen in service. So the first target will be a 4-week referral to assessment and an 18-week referral to treatment. These will come in, as I mentioned, in the new year. With the increase in waiting times, our providers are trying to respond to this and are already working towards the 4-week referral to assessment, and they're achieving 79% at the moment of referrals coming in. They're also working on an aspirational target of 12 weeks of referral to treatment and are achieving 72% at the moment. I'm now going to hand over to my colleague Dave Carr.
Thanks, Helen. So I thought I'd start off just with a couple of extracts from the health needs assessment. So this is something that's done every year through the school nursing service. And we asked children, young people at year 6 and year 9 a whole range of kind of questions about their lives. And year 6 is kind of age 10 and 11, year 9, 13, 14. And the first one was, how often do you feel happy? It's a pretty fundamental question. And in this year, when we did that survey, 91% of year 6, 81% of year 9 said actually they feel happy always or often, so not bad. But the thing that sticks out is actually, if you go back to 2019 when we last did the survey, there's a difference. Actually, young people are less happy than they were a couple of years ago. That's what they're telling us. And the other one that I pulled out was that, do you feel hopeful about your future? As a young person, if you want nothing else, then actually you should be feeling optimistic about the future and your hopes and dreams and your life and everything. And on this one, for year 6s, 89% felt hopeful, always or often. For year 9s, 79%. But again, it's dipped, certainly in terms of those 13, 14-year-olds. Then actually the percentage that are looking positive in their outlook is gone down. So there is something about the last couple of years, and part of that will be COVID, but actually it might have been a thing that would have happened anyway. When we've unpicked some of that data a bit, it was quite stark that certainly at year 9, if you look at the girls who are eligible for free school meals, those from a white or other ethnic background, those in deprived areas, those were the ones that were more likely to hardly ever or never feel happy. So there is something about deprivation, I suppose, and where you live and what your environment is like that probably influences on whether you feel happy. And that's probably no surprise, but actually that's kind of what the data is telling us. And similarly, when you think about the future, and actually what young people think of the future, very similar. So it was girls eligible for free school meals, more likely to hardly ever or never feel hopeful about their future. So it's kind of just a place to start, really. If you go on to the next slide, please. Can you hear me, Helen? She's trying. Okay. So this is just a picture of some of our demand that's coming through early help, and it probably mirrors what Helen said about the NHS services. Really squiggly diagram, but it covers the past couple of years. So what you can see is that this year, visually, actually there's been quite an increase in referrals that are coming through to our county council commissioned early help services. Referrals have gone up by about 10.5%. Year on year from September this year to September last year. You see a bit of a dip in March 2021 where things look like they've fallen down. That was actually not because no referrals were coming in. We gatekeep the referrals. They come in through our Children and Family Wellbeing Early Help Service. So actually what we were doing, because we'd run out of commission capacity, was basically stacking, I suppose, the cases at that point and signposting people to alternative bits of provision. Move on, Helen. And this is where the referrals into early help comes from. And I suppose what surprised me when I first saw this was you've got an age range that goes from 4 up to 18 on there. And actually 28 referrals for 4-year-olds that came in. By far the bulk of the referrals were for kind of 8, 9, 10, 11-year-olds. Very few referrals coming in from for older young people, kind of 16, 17, 18. I don't think that is an issue about the demand and the need being out there. I just think it's about how we badge this service, and it is quite focused on engagement with schools and through children and family wellbeing. So we've, alongside other bits of work that we're doing, there's a piece of work with colleges at the moment looking at actually what is the support that colleges need to be able to get young people to access the support that they need. The other thing that I suppose I'd highlight, and again it mirrors what Helen said about the NHS demand, was around the referrals and the waiting times. So there's a target under this service for young people to be accessing support within 4 weeks. And what we've seen over the past year or so is actually the numbers on the waiting list is increasing steadily. So there is demand throughout the system that we're seeing at the moment. And I shall hand over to Fleur to talk about eating disorders.
Thanks, Dave. So I'm going to pick up specifically one of our services which has seen a huge increase in demand, and this is our eating disorder services. This includes, well, it's all age, but I'll pick up the particular issues related to children and young people. In comparison to this time last year, we're seeing a huge increase, and you can see there in the text that we've seen between July and August, we saw a 61% increase in comparison to the previous month, and that's for our population group that are under 19. How we measure this, and I will go into a bit more detail because from my perspective, I don't want to hit a target and miss the point. It's about ensuring that we've got the right services in place for this population group. But we are monitored from an NHS England perspective, which is our governing body, in terms of how quickly we see these patients and these children and young people that are referred into our services. So we have 2 targets that we're expected to meet. One's an urgent referral requirement, which is within 1 week, and then we have another which is our routine referral. So any patient that's sent into the service, they're all screened, and those that are deemed as urgent are seen within 1 week, and we're actually achieving now 100% of those children and young people that are referred into the service are now being seen within 1 week. We did dip significantly at the beginning of the summer, and I'll just talk through some of the things that we did to I suppose, support that service to get us to a place where we're now achieving 100%. And then the next target is the routine, which is that any patient that's referred in is seen within 4 weeks. We're achieving that across the system between 50 and 100%, but we anticipate that we will achieve that by 100%, so that 100% of children and young people that are referred on a routine basis will be seen within 4 weeks in early January. Just in terms of some of the things that we responded to and that we know are happening. So there are a number of patients that are referred into service, some of which stay in the community. So some of our young people stay in the community and they're supported by our community teams to stay at home. That's the right place for them to be. And then others of our patients who are particularly unwell, who need that additional support, are admitted to either a specialist bed, an eating disorder bed, of which there are very few across the country, or they're admitted to our acute sector beds, so into our normal general hospitals, for support in those particular incidences. And what we see for the patients who go into our specialist referral beds, they are treated by those experts and then usually are discharged from those beds. The other patients that need that physical health support, so we do see that these patients do have physical health needs as well as mental health needs. And so what we are trying to do at the minute is make sure that those patients that are admitted into our general hospitals, onto the paediatric wards, are supported both from a physical health perspective, and they might come in with a low body mass index, they might come in with deranged blood results. So that needs to be supported and those need to be resolved, but also accepting that they do have emotional and well-being requirements, which, if I'm honest, our acute sector, so our normal general hospitals, don't necessarily have that expertise to support those patients. So we're working very closely together with our general hospitals to make sure that any patient that gets admitted to a general ward is supported from both a physical health requirement but also a mental health requirement. We also have instigated a weekly meeting, which I'm part of, which looks at the whole system. It includes adults as well, it's not exclusive, but particularly focusing on those children and young people that are either in the community or in one of the specialist beds or in our acute sector beds, and we receive an update as to their progress and just making sure that if they require something slightly different, it's responded to. Obviously, we don't wait for that meeting to support any transfer that's required, but I think it's really important that we keep focused on these young people to make sure that everything that's possible is being supported for both them as a children young person, but also their carers and families, because the carers and families do an awful lot of support in the community if an acute sector bed isn't required. Thanks, Helen.
Thank you. I just thought I'd highlight some of the responses that as a system we've made to COVID-19 and the pandemic. So one of the common issues, I suppose, is people saying, actually, where do I get help? Where can I go for support and advice? And that applies to individuals, but it also applies to professionals as well, that there is so much stuff out there that it's bewildering at times in terms of the amount of services and support and self-help guidance. So what we've tried to do is pull together an awful lot of that support and advice in the Healthy Young Minds website. So that's across Lancashire and South Cumbria. And it's got stuff in there which is quite targeted and specialist, but actually it's got things like information on the self-help scheme that the Library Service runs, where actually they've got a collection of books which have been endorsed by young people, and you can go and read and find out more information. There's a self-referral pathway into child and adolescent mental health services, so you don't have to be referred by a professional. Actually, you can self-refer into those services. There's a new all-age mental health crisis line, 24 hours a day, 7 days a week, and that's run by Lancashire and South Cumbria Care Foundation Trust. We've got safe space pathways, so that's a place that young people can go when they would otherwise go to A&E out of hours and potentially end up on an inpatient bed on a paediatric ward. We've developed guidance for schools and working with schools in terms of promoting positive emotional wellbeing and mental health. Some of that has been very much driven nationally in terms of programmes which the DfE have put out to encourage that kind of wellbeing for education return. We've worked quite closely in the last year around the schools and settings. So certainly when schools weren't fully open, we were trying to make sure we had eyes on and a line of sight still on those young people who were at home and vulnerable at that point. So we had a multi-agency team sharing information around the concerns that people may have had. We've invested in the Lancashire Emotional Health in Schools and Colleges service, and Marie will talk a little bit more about that in a few minutes. And then we've shifted, I think, during COVID, like lots of services, things have moved online. So our voluntary sector counselling services, a lot of that activity moved online during the lockdowns. Some of that has gone really, really well. And actually it's the same in terms of other bits of the system. There's something about a hybrid approach, and actually people are valuing that easier access that some people get online. And similarly, we've had a platform called Cooth, which is an online counselling support system for young people aged 10 to 18, which is being commissioned for any young person in Lancashire to be able to access. So lots of stuff that's being done as a system response to COVID. I think there is always more that we can do, and we're seeing the pressures in the system. But when people say there is no support out there, sometimes it's about finding the right support that's there as opposed to there isn't any support. And I'd like to invite our youth council members, if you would like to say some words about the work that you've done.
Thank you for inviting us to speak this morning. So, young people chose the topic of mental health as the university unites all people. We all have mental health, and it is probable, if not inevitable, that we will struggle with it at some point. However, that doesn't negate the fact that there is an increasingly common issue amongst young people, and we wanted to examine the causes, symptoms, who those most susceptible are, and the provision available for young people struggling with mental health issues. Amongst our youth councils, we were able to elucidate for a wide range of perspectives, and there was a common consensus that the resources that they were most commonly directed to were inadequate. The study highlights the ubiquity of mental illness and emphasises the importance of celebrities in the role of destigmatising the matter. Many of the boys in our youth councils were impacted by certain footballers addressing the crisis, particularly amongst men, and working to resist the patriarchal views of masculinity and subsequent pressure on men and boys to suppress their emotions. When looking at the causes of mental illness amongst young people, we addressed a wide range of catalysts. But I wanted to hone in on the points raised about the stress and anxiety caused by growing up in a financially unstable background and the inextricable link between mental health and child poverty. We also looked at the negative impacts of things such as social media, exams, family relationships, and bullying has on mental health, which you can read about in more detail in this study.
So we also came up with an extensive list about how your mental health impacts young people. So I'm going to read out a couple of them because it's quite a long list. I'm not going to read them all out. So we came up with that it makes people feel more withdrawn and isolated from society. And it can also impact your physical health. That young people often who are struggling with their mental health often feel a lack of self-esteem and confidence. And it can also lead to like an addiction with substances and misusing substances. It can also lead to presenting differences in behaviour and losing interest in things that you'd normally be interested in, like hobbies and what you enjoy. And another thing was impacting education, and so your grades would go downward, and it can also lead to a vicious cycle. So you feel worse about your grades going down, then it just carries on. We also looked at suicide, and so we chatted about that sometimes people don't want to lose their life. They just don't want to be in the present moment because of the emotional and mental pain that they are experiencing, and that people try to cover it up because of the negative stigma associated with mental health.
A young person developing mental health illnesses will not often reach out for help. Someone who experienced this may try and keep it in secret. You should approach these people in a caring and non-judgmental manner and let the young person know that you are concerned about them and want to help. You need to also understand that a young person might not trust you, so you need to be more open and try a different approach. If possible, you should approach the young person privately about their experiences in a place free from distractions. If a person is unwilling to tell you and talk to you about it, do not force them to talk to you about their experience. Rather, let them know that you will be there for them in the future. We researched places people could go for support, such as schools, mentors, GPs and kids. However, we realised during this that some people felt failed by the services and need better.
So now we've moved on to how we could support victims of mental health and the causes of mental health. To begin this off, one young person suggested that schools could hold clubs at lunchtimes and breaks where young people who fear they're feeling anxious have a safe space to go away from the crowd, to get out of that environment where they feel pressured about certain things. On top of that, the young people can discuss the issues they're having and create friendships with other young people in similar situations. They have somewhere for them to go and get support in a quiet and relaxed area, which will obviously reduce stress and different emotional strains on them. They have peer support groups, so vulnerable young people have the opportunity to talk to someone nearer their own age, so you have a different range of relatability there. Support could come from within school, but maybe a teacher who students particularly like or is popular amongst, student counsellors as well. Then some supporting information from the youth MFA. Some additional supports are important factors in improving a young person's chance of recovery from mental health. Again, we see that trend with a stable and secure social environment with decent housing. So we're looking at a wider issue here, really, in the trend of people born in areas of where there's mass deprivation are more likely to have a reduced state of mental health. Support from family and friends and opportunities to stay in school or college and suitable work and play a meaningful role in society all play their part in promoting well-being for young people experiencing mental health, just as they do for the rest of us. Family and friends, of course, are another very important source of support for a person with a mental health condition. A person's likely to recover far more quickly and do better if they have a good relationship with their family. And again, I think that's where we can link it back to people in areas of depravity. We can see they probably will not have good relations with family due to the added social stress. And again, we see this spiral where deprivation and poverty plays into this narrative.
And then of course, checking if people are feeling suicidal, if they're having bad problems with emotional needs, and taking immediate action on that if they are having those problems. And then underlining all of this is gaining an understanding of mental health to help the young person come to terms with their diagnosis. And I'll just list off a few points and give the feedback. Helping young people to plan for the future, we need to focus on points of building a positive self-image, increasing control and responsibility over their lives, supporting self-advocacy, and giving the young person information. Thank you.
Thank you very much for that. So just following on, obviously it's important to give the voice of the young people, but also it's about how can we support our workforce as well. So Lancashire Emotional Health in schools and colleges looks at how they can support the staff. So it's commissioned by LCC Public Health to provide training, support their own wellbeing, but also to support the young people that they work with. So this has been offered recently both online and also face-to-face. There's a team of clinical psychologists in place that are based at Lancaster University, and they're delivering right across from primary to colleges. So coverage has been 75% of primary across Lancashire, 90% of secondary schools, and 96% of colleges. During the COVID period, there's been an online information portal developed by the service. It's been accessed over 24,000 times since May 2019 for parents and young people to get support, and for staff as well to be able to support young people. So during COVID, we've seen a demand in certain issues. So there's been a bereavement training that's been developed for staff, also parental support for them to be able to understand mental health and support young people with issues around mental health. There's also been one-to-one consultation sessions delivered by the provider to school staff, which has had a rating out of 10 out of 10 so far. There's been core areas of delivery, which continues to remain in place, which is about understanding trauma, anxiety management, communicating with children in distress, attachment theory and low mood. Aside from this as well, the Department for Education has released some NIP, and there's been a senior mental health needs training offer that's been made by the provider, which is going to work with local authority educational psychologists. So the senior mental health leads are going to be within schools, and they're going to provide support within that setting. There's also been links to inclusion and support in their support teams, supporting school staff to support pupils who have special education needs and disabilities, and also to support young people who are at risk of exclusion. Some of the feedback that we've seen recently about making positive changes from staff member, I found the staff wellbeing sessions that I attended extremely helpful, and I devised a wellbeing presentation based on the content and principles that have been shared and delivered into our middle leaders. Received a great response as they really opened up and allowed us to make some real changes, which is some great insight. As Dave has already mentioned, there's been a focus around colleges the last couple of months, how that we can support staff members there and also young people through targeted meetings to meet the needs of young people. As part of a home school and system approach, the service has been linking with wider services, including the mental health support teams, which Dave will cover in a moment. The collaborative working around that since provision for schools and conversations which provide intelligence for both parties to listen to and understand the needs of both staff and young people, and where additional support is required, which has been really positive. As an example of that, anxiety management for staff, demand has been considerably increased. We've seen over 1,000 staff members accessing the e-learning courses. Aside from that, it's been about helping staff to work together and also how they can support parents to support young people when they need to have the conversation around mental health, make sure that the facilities and support, which is mentioned in your report, is joined up, and now that parents can understand the behaviours of young people and support them on what they can do to help and where they can get information. So the providers also acknowledge the need for staff to be able to talk and share their experience. COVID has been quite, has put obviously pressure on our workforce. Over 90 staff have have been supported so far, received one-to-one support from the provider, and it's been very well received. It was mentioned the 10 out of 10 feedback. It's been very well received, and it will continue within this provision. It's also been acknowledged about having the opportunity of listening to people, so staff and young people, as you've mentioned in your report. It provides an insight for services, for local authorities be able to reflect and to adapt to needs and look at the actual service offer. So I really welcome what you've written. Some of the work that you've mentioned around peer support frameworks is some discussions that we've already had within our group, and also how that we can support teachers to have those conversations with young people within schools. So we'll take that forward and we'll reflect on that, so thank you very much.
Hi everybody, thanks Marie. Sorry, I was having difficulty coming off mute there. So I'm David Keegan, and I'm here to talk about mental health support teams from a national perspective. So I think you'll have heard Marie speak about the mental health support teams, and these were kind of created over 2018 and actually started in process from January 2019. And the aim of a mental health support team is to look at a school or a college setting to actually support the wider children and young people's mental health needs in a kind of mild to moderate, low intensity mental health setting. The core aim, I'd say, around it is to kind of look at recognising children and young people's mental health issues from an early point. So some of those are about doing a whole school approach around recognising that, as people have said already today, that we all have a mental health, and that how we look after our mental health and how we understand our mental health is really, really important. And I think from my own background, what I've seen is lots of individuals who, by learning skills later in life, have learned skills to be able to cope and deal with the mental health issues that they experience. And what I would say most people would say is they wish they'd known that in the past. And I think that is what the mental health support teams in schools and colleges is fundamental in its background. It's kind of how do we enable people to understand mental health, to know how to ask for help and to seek help when they need it, but also to have skills already to kind of prevent issues from exacerbating, or to give them skills in being able to cope with issues when they happen so that they can seek help at an appropriate time. So as you can hear, I'm quite passionate about all of the aspects of what an MHST can bring and offer. The whole point of an MHST is for it to be individual in its setting. It isn't about creating one block that can be put absolutely everywhere. It's recognising what's needed within a locality, and then what's needed within a school or college setting. It isn't about creating duplication. It is about adding to and making sure that we are looking at high levels of deprivation, high levels of need, and what are the elements that are recognised within your locality. So there may be similarities across the country, but there's also extreme differences, and there's extreme differences just in each locality. So it is about how do we take that, how do we recognise that, how do we listen to the children and young people, the parents, carers, and families of the children and young people in each locality to make sure we're recognising that. So we do that by delivering training, looking at wider support, consultations with the schools, and also with parents, carers, children and young people, and creating a new mental health workforce that will be a part of that. So the new mental health workforce is what we call our educational mental health practitioners. Can I move on to the next slide, Helen? Thank you. So our educational mental health practitioners are a brand new workforce, as I said, that are created to be based within school settings. So in 2019, when we first started, the EMHPs, or the educational mental health practitioners, were the first element that we recognised, and how do we support them in taking it forward. Very quickly, on looking at the first of the Trailblazer year course, which was the one that started in January 2019, it was recognised that we actually needed quite a formal structure to kind of support the whole team, but also recognise what further individuals needed to be able to do to facilitate a team. So as you can see, the structure was created as highlighted on the slides in front. So this was a structure of 4 EMHPs with 2 Band 6s to support them, a Band 7, and these are all support around clinical supervision. These are all the EMHPs, because they're working in schools, will be working in isolation. So some of these Band 6s and Band 7s and possibly the Band 8A may also work into the schools to support the schools, to enable the schools, and to deal with maybe more difficult situations or challenging situations, to make sure they fit within the criteria, or to make sure that we're kind of moving people in the right direction. It was felt it was essential to have 4 EMHPs in every team, so that what we were actually having is a core profession coming in. So educational mental health practitioners did not exist. It's a 1-year training that they go on. It's a lot around the CBT modality of one-to-one work, but also around the whole school approach. So it's a really interesting point of work. And when the adverts are left out, we have about 800 applicants for those jobs. This is not something that people think could be something for them. It's something that I think a lot of people recognise, and a lot of people are really interested in working in this area. So we're really excited about taking it forward. The whole school approach element was created to enable how do you support the wider insight into an education setting, but also into the community setting that education establishment is within. There's no point in just telling children around recognising their mental health and understanding their mental health, and looking at skills around what they could use to help and enhance their mental health, if the teachers or the other staff within a school setting don't understand it. But also if their parents, their families, the people that are around them don't understand it. So how does that information get out? How do we connect with the whole community? And that's part of the whole school approach, to make sure that actually we're communicating wider than just that single structure of that one child. It's connecting with all children. And we're seeing massive changes around it. And schools can sometimes recognise that there's issues that have been highlighted. And I think Dave earlier spoke about free school meals and deprivation. And what we can see is this isn't pinpointing any member of a community. This is just recognising actually these are the skills that are really, really useful for everybody, but they are particularly useful for people who are dealing with difficult situations, who are dealing with challenges, who are dealing with an issue of difference. So what we see is that we can recognise this in looked after young children. We can recognise this in children from the LGBTQ plus community and wider. So what we can bring in is disability recognition. We can work with SEND. We can work with the specialist schools and the PRU schools within your locality, all using the mental health support teams. So that's a little bit of an overview of mental health support teams. I'm sure there'll be lots of questions. And my last slide is where you are in Lancashire with your current teams. So this is Lancashire and South Cumbria. So as you can see, we started with 3 teams in Blackburn and Darwen, and 1 team in Morecambe Bay. And that was in January 2020, and then we've moved forward as we've kind of tried to move across all of the what are CCGs within your locality. We now have, and so from January 2022, so we're nearly there, we will have every single one of your CCGs having an MHST. So that means they're understanding what a mental health support team can offer. It is limiting of what a mental health support team can work with. It's to about, each team can work to about a population of 8,000. So there are more teams needed. The aim was to get to 25% coverage by the end of 23-24. What we're hoping to be able to see in Lancashire and South Cumbria is about a 45% coverage. Now, hopefully what we'll be able to see is further teams coming on board after 23-24. It's completely the expectation from a national perspective of how do we increase the workforce and how do we take that forward, and then hopefully to gain to full coverage. Because of other elements that you've got within your locality, some of those elements can be covered more wider, but I think it's a really exciting opportunity. And I think when I speak to, as you can see, the sites that have already started, even the sites that started in September in Blackpool, Enfield and Wyre, it's really strong, the language that's coming from those schools and coming from those communities to kind of say, this is really recognised, this is really useful, this is really powerful. I can see a difference from sometimes just one session with an educational mental health practitioner. So what we know is this is about recognising the support that's needed, and I think it's been needed for a long time. It's just, how did we get this off the ground, and how has it moved forward? The pandemic has, has impacted on how all of this can be set out, but it hasn't altered the timeline. We've kind of moved through in the same way. It's all gone online. It can be difficult for EMHPs to work into a school where they've never physically possibly even been in that school. So hopefully as the pandemic changes, then we'll have more access to schools for some of those individuals, and some of those individuals who've been working with the schools from the very beginning are just seen as a member of staff from that school, and I think that's what we think is really strong. On top of this, we also have from the Department of Education the Senior Mental Health Lead training, and the Senior Mental Health Lead training means that every school and college across the country has access to a Senior Mental Health Lead, which is a member of staff who is trained around mental health to understand and to help look at those cases and to help look at supporting the school and entering into that whole school approach. So we hope that as we go forward with the MHSTs, we'll see things moving even faster, because schools will be really ready for MHSTs as they come in. I'll try not to take any more of your time, but thank you for listening today.
Okay, so I'm going to talk around the transformation programme, which is our next stage. So earlier this year we did a robust statistical modelling exercise, and we were able to transfer this into a sustainable financial model across Lancashire and South Cumbria, and have secured an additional 10.8 million investment over the next 3 years to meet the capacity and demand across all our integrated care partnership areas. As part of the pathway redesign, we wouldn't have got to this stage if it hadn't been for the co-production that we'd undertaken in the previous couple of years to get us to a clinical model. So working with lots of stakeholders and primarily including children and young people and their families and carers. So in year one, we have 4 agreed priorities. So we are looking to increase access, continue to increase access to children and young people's services through what we call an all-age front door. And this will be called an initial response service, IRS. And this means that any referrals, routine or urgent, 24/7 will be able to be directed through the initial response services for forwarding on. So there won't be a closed door. Referrals will be passed through to the appropriate place. We're also looking to develop our crisis risk support and home treatment offers at place. We're also expanding our workforce model so that we can deliver the transformed new model of care, and we're also going to enhance our work with the voluntary community faith and social enterprise providers through further investment and partnership working, and continue to increase our spend with them year on year. In terms of years 2 and 3, we will continue the transformation of our CAMS services. We're going to look at investing in early and appropriate interventions, which will help to build and maintain resilience and prevent escalation to crisis. There's going to be a greater focus on the longer term development of digital services and clear signposting, as we've already mentioned before, so that children and young people, parents and carers and professionals know what's on offer and how they're able to access it. As part of all this, we will continue with the co-production because it's so important, and to make sure that we get things right.
Thanks, Helen. So you'll be pleased to know that we're coming to the end of the presentation. So thanks to partners and young people for their contributions. There's nearly 50 minutes worth of stuff that we've talked through there, so we thought it'd be helpful just to end with a slide in terms of if you need help, where do you go? There's a lot of support and resources out there, but sometimes it's just finding the simple stuff. So we have the website, which has got a whole range of information and materials for self-help and information for professionals. But the 24-hour mental health crisis line is absolutely fundamental in terms of support to people at times. We've got our chat to health service provided by school nurses, so that's a messaging service that young people can text into. And we've got our talk zone service through the Children and Family Wellbeing, so that's an email, but it's also a kind of evening helpline as well that people can call. So there's stuff out there.
Well, that's been a lot to take in this morning, so I thank you to all presenters for all the information, especially our young members. Lots of burning issues there that I'm sure you're going to be asking questions on. We've got to think about the recommendations this morning, what we've gone through, and what we want to take further to the Cabinet. So, Samara Barnes, would you like to go first, please?
Thank you for a really full presentation. I've got a couple of questions about early help and a couple about eating disorders. Do you want me to do them separately or all together? Yep, okay. So regarding early help, the one thing that I picked up on, which talked about running out of commissioned capacity, and I'm just wondering why that happened and what's in there in future for it to not happen again. And also why there's such a big difference between the number of referrals in Chorley to West Lancs in terms of the early help offer, and whether that is something to do with the geography of the area, whether it's something to do with, as you say, how it's badged and how people know about the service. And then with eating disorders, my main question was around some of the data that was presented. And it was only presented in terms of binary genders. And I'm just wondering whether that's done for any specific reasons, because young people who aren't cisgendered are actually 4 times more likely to have an eating disorder. So I'm just wondering how that's represented and how that's presented in this document. Thank you.
Okay, thanks. If I pick up the first 2 around early help, and then Fleur, do you want to think about the eating disorders? So in terms of early help, we buy in a certain amount of capacity in terms of referrals that providers can take. During the course of the year, we try and manage that. So if there is one district which is kind of low in terms of percentage of referrals coming through, we will kind of offset that capacity so that they can take referrals from other areas. So it's a juggling kind of exercise throughout the year. There is always a risk that when you get to the end of the year, that actually the caseload is full in reality. So it's then the question is what you do about it. So all those requests for support come through our Children and Family Wellbeing service. So we have targeted support teams, we have family support workers, and a range of people other than our commission service who can provide support and advice to young people. So it's about trying to prioritise, I suppose, in reality at that time in terms of how you support those young people. Some of those young people are also on camps waiting lists and getting support from counsellors. Sometimes it's about a holding position and some risk support, I suppose. In terms of what we do going forward, so we know it was an issue last year, and we are working with the provider at the moment to say effectively what will it take to make sure that we don't end up in that position again. In terms of Chorley and West Lancs, and there are other differences out there, I don't know, I suppose it's the fundamental, but we see quite a variation from different districts coming through. There was something in terms of early help generally around the Chorley area over the past 12 months that we saw. but we've seen kind of different referral patterns from different districts at different times. Some of that might be awareness, some of it might be that actually there are different support providers. So our commission service isn't the only support provider out there. Schools are buying in other services. There are voluntary organisations out there as well. And I'm sure that that will have something to do with the level of referrals that come through our front door. And that's part of the challenge of working the whole system, really, that it's trying to make best use of the capacity that we all have, not one bit of the system. And sometimes that means we end up with a real mix of provision in different parts of the county. So when we're challenged to say, so what is the offer in West Lancs? I know what the county council offer is, I know what the NHS offer is, but actually to unpick what individual schools might be commissioning themselves and what local communities are doing for themselves is quite hard. And I wonder whether that's really an issue or not. If the service is there in that local community and people are able to access it and know about it, does it need to be this big centrally controlled thing which potentially isn't responsive to people's needs in that level? So, but interesting conversation. Fleur.
Thank you. Thanks, Councillor, for the question. In terms of the presentation, we do have a huge amount of data that sits underneath that. We can tell you by gender, ethnicity, and so I suppose for ease we just did it in that way, but if councillors are interested, we can certainly present the data in numerous different ways if that would be helpful.
Thank you. That's would be handy actually. And just very quickly onto the point that you made, I think from what you were saying, then actually the ones where there are very low referrals might be because actually they have a really excellent offer outside of the early help. So it could be better that they're on zero.
Councillor Ron Woolen.
Thank you, Chair. Yeah, I'd just like to ask a question of the young people here today about signposting. Do you feel there's enough signposting in your schools and colleges at the moment? Where would you find it? Would you have easy access to it? Thank you.
Well, I think the first point of what most young people go to is the form tutor. That's kind of when you first start, first through secondary school, I suppose. The first, you're kind of told if you ever need any help, you go to your form tutor, and then there's someone in school who's in charge of pastoral care, and then I think you just kind of go through the system. So then you have to be seen by them, and then you're referred on to the CAMS waiting list. From the study that we did, the people on the youth council who had that experience more or less said that what they kind of had to wait for CAMS, and then they once they actually got on there, it wasn't actually that helpful. So I don't know how many people here are on TikTok, but there's like a kind of running joke. It's not, I suppose it is a joke, but it underpins a more serious matter that you wait for CAMS, you wait and wait and wait, and to get on a phone call for them to tell you to make a cup of tea, and that'll make you mental, that'll fix you. That was just kind of the general attitude that most young people presented to us.
It's basically like the same circle in every school. Like Maureen said, you get told to go to your form tutor. Your form tutor will then tell you to go to, well, in college now it's called student services, but a lot of people, they're just telling you to do things that you as an individual wouldn't do. So like someone that didn't like exercise and that all got told to go on a run for half an hour every single day. So it's just kind of a weird circle that's not really helpful.
I think with some things as well, sorry, hi, so I think with some things as well, there are external services that like aren't CAMS, so you can access like other things, but you kind of have to be aware of them in order to kind of go to them. So it's, I think in a lot of cases, yeah, CAMS isn't necessarily great and the waiting lists are ridiculous. From my experience and from talking to other young people, which will lead on to a question later. But you kind of have to, I think everyone goes, you're clearly struggling, so we're either going to leave it or we're going to refer you to CAMS, but nobody actually says, right, these are some other things that you can use to help yourself that aren't CAMS, that also aren't go out for a run and hope for the best sort of thing. So nobody says, so like obviously you've got COOS and like Young Minds and that, but and other charities that can support you, but nobody actually raises awareness about them. It's just a case of you either hope you've got people around you that know about them and can tell you about them, or you kind of just left waiting for someone to help you when you're deteriorating, and it's not great.
I also think that it is getting better in terms of signposting. So I think it's becoming more like normal in schools. So for example, in my secondary school, they've started within the newsletter advertising places, other places you can go that aren't the most used system, and I think it is generally getting better.
That's great. Thank you. Very, very useful information. Thank you very much. Thanks.
Can I just ask you then on that topic, what do you think we could do better to make sure that it isn't just a member of staff, that you can actually find that information? What does every child need in school, in high schools especially, to know how to get there? What if they haven't got access to a computer when they go home? What if they're afraid to approach somebody? What could we do better?
You could create posters that with the information on, and obviously I know young people don't usually read them, but if it's like colourful and like not much words, but it's on there. And also, I'm not sure if every school does this, but in form time, it could, like on the screen, it could be gone through as well, so that because everyone can go through it as well. So, yeah.
Do you have, is it Noodle or something that's on there where you have to look for all your lesson plans? So flashing up on there or having a link with every contact on, would that be better?
Yeah.
Have you taken that down, ladies and gentlemen? So how do we promote it so that they get the opportunity to make that call in their hour of need? That's what you're looking for. Thank you. Who's that? Sorry, come on, Amber.
Something our school did where a lot of people didn't feel safe enough to fill out the forms online because a lot of people went into other people's accounts. So what they did was they had like these little slips in classrooms that you could take and fill out wherever you wanted, and then you went and posted it in a box near reception. And then through that, and they also had the option of actually speaking to someone, or would you like to speak to a teacher, and they will also come to that meeting if you wanted to. So there was like several different ways to go through the process before you actually went and saw the mental health specialist.
So putting a note in the box, somebody would look at it, but you could have maybe other students in school that could befriend somebody or have a scheme, so that's something that could be taken forward. Is that okay?
Another example was in Lancashire. Indeed, I've been part of this scheme where it was to promote mental health counsellors amongst young people. So young people could go to their school mental health counsellor, and there could be multiple within the school. And the problems they told to that youth counsellor could then be in turn either explained to staff indirectly or commuted to different organisations through that person. And that scheme saw relative success when it was run in certain parts of Lancashire, because that was part of that programme. And I think that would be something to be looked at on a national level.
Carry on.
I've got one more example. So I go to a Catholic college, and as part of that we have mandatory like RE lessons, and within those it's not necessarily religious, but there's a lot of talk about ways you can improve mental health. So for example, last week we did meditation. Now meditation is not going to work for everybody, but for a lot of people it will, and it's about like having that designated time to help young people find what's right for them.
Councillor Antietam.
Good morning. I've never had so much information in my life, and I'm not quite sure how much I've absorbed, or whether I've got so cold that I think that I might go and have a designation of how to get warm again, which is most probably running around Preston to get the circulation going. I would just like to go back to primary education, and particularly where we do have youngsters who are examined for health. And one of the things that seems to come up, and Lancashire does not come top of the table here, but we do seem to have a lot of smaller children who have obesity, an adjective which I absolutely hate, because I think it puts a stigma on those children before they've even got started in life. But there was one thing that did just attract my attention during that, about in a number of schools now, particularly in primary schools, we have started breakfast clubs, and we have found that if they have a breakfast club, if they come in for a breakfast club, then that does seem to sustain the little person until their lunch break. But then we find occasionally they don't take up the lunch break because they've had the early breakfast. They don't think they should be having a lunch break, you know, and eating what has been put before them. And then we sort of have to try and speak to the parent and try and help there. But it is a difficult one to just get the balance right to help little ones, and who somehow have a fear of, first of all, being introduced to strange food in some instances, and then trying to get the balance right. We have some very good, I have to say, school cooks. We really do, and trying to get it out of the children, you know, what they would like or what they're trying to enjoy. I mean, some of the things are not quite as good as they should be, but it's trying to make a little person feel comfortable in their diet, but they don't want to have the Billy Bunter expression, which I don't think is used very frequently now, but when I was little, Billy Bunter was often held up as an example of overeating or having the wrong food. And I just wonder how we're getting around that now. I think there have been some improvements, but I'd like further reassurances, and I just like the idea about the breakfast club that came up, because I realise some parents do have to start work early, just as another thought.
Yeah, we might have to take it away, Councillor Cheetham, and get some more information. I do know that there are various programmes at the moment looking at healthy eating and healthy weight. I haven't got the detail of those programmes about kind of where they're targeting in terms of primary, secondary, and so on. And you'll know through our own school meal service and in-house that over the years we've had a number of kind of different programs like Healthy Heroes to encourage that healthy lifestyle. But you're absolutely right that obesity is an issue in Lancashire, and we certainly need to tie that into our kind of school meals and catering response and our public health activity.
Needs to be tied into dentistry, because we have the worst teeth in the country. So there's something that is not blending with what we're trying to encourage youngsters to drink and eat there. But I mean, it's just that little bit worrying, Chairman, and I hope we can just have an element of future. But can I just say that the school cooks are absolutely fantastic, and I know they've really had to be very clever in the last month or two, and all praise to them, but you never just get it just so that we've got a future with them. And I don't want these little ones going with a little stigma when they transition into secondary school. Thank you.
Councillor Cheetham, we're having that on our next meeting in January, so you'll get all the rundown on that. Now it's Councillor Steve Rigby, please.
Yes, thank you, Chair. The presentation on screen was a little different to the presentation I've got in front of me towards the end. So the question might not be able to be answered, but there's a page 24 on my presentation which talks about the funding for the mental health support team. I don't know if anybody's got that page on the online presentation. Any answers? Anybody volunteer to see that page? Page 24, we've got it typed as, but it talks about the funding.
The presentation was changed to make it easier. I think it was it Helen? Did you do that item, Helen? So you decided to change it on the last minute to make it easier, I think.
Yeah, it was after we met with your chair to make it a little bit more easier for us to talk through. I'm just trying to find the page.
Okay, yeah, it's while you're finding it, I find it difficult to understand the financial information. One of the tables talks about WTE, which I wasn't too sure what a WTE was. And then obviously in the purple bits it talks about BTH, FT, ELHT, LS, CFT. I'm sure you'll be able to explain those. The kind of more general point was about the finance. If it's 10 million, is it able to be carried over each year? Because it's obviously a rolling programme on mental health support teams. And I take it the WTE at 15 is people, or underneath it 991,000. Is it something that will be carried over every year, or is that 1 year spend, or is that 2 years spend? It's just a little bit confusing, so really just a bit of clarification on the finances.
Yeah, so that slide referred to some of the investment that I mentioned around the 10.8 million. So the WTE refers to whole time equivalent. So this is the number of additional staff that were, or the workforce that we're going to be bringing in. And the BTH FT are the organisations. So BTH is Blackpool Teaching Hospitals. ELHT is East Lancashire Hospital Trust, and LSCFT is Lancashire and South Cumbria NHS Foundation Trust, and that's where some of that money, the funding is going to increase that capacity for mental health services for children and young people. So that was part of the review that we undertook, which I mentioned earlier in the presentation.
Could I just ask a supplementary question then? In terms of that 10.8 million, did it run out in 23, 24, or have you secured some more? Because obviously 133 people will be employed and will need to be consumed into the full-time equivalent post in all those hospitals. So is it short-term funding, or is it presumed it will be mainstreamed?
Yeah,
Shall I answer that one, Helen?
Yeah, sorry.
So, thanks, Councillor. So we got the investment from the system, and that was on a recurrent basis. So it's staged over 3 years. So over the 3 years, we see an increase in that investment, but it certainly isn't planned to stop at the end point. It will be recurrent and be available into what we might refer to as baseline or everyday funding, but it will still be earmarked for those people and for those services to make sure that they continue, unless, of course, we find them that's not what we want to deliver as we move forward. But it's certainly recurrent.
Yeah, thank you very much. Thank you.
Waiting patiently is Sobia Malik. She's online. So Sobia, are you there, please?
Thank you very much for the presentation. It was really interesting, and I wanted to support the comments by the Youth Council in particular, because I think they were really profound, weren't they? You can feel that lived experience, and it's kind of overwhelming, a bit sad as well, because the truth is really challenging. And I think as somebody who's been a teacher for over 20 years, or former, I should say now, even though in my head I still think I am one, and I trained as a therapeutic counsellor nearly 20 years ago as well. And what makes me sad is to hear the young people saying all the things I thought we needed at that time, 20 years ago, within education. And in reality, the data indicates there's a huge demand, and we're struggling to meet that. Officers are doing their very best within the confines of the realities of what your infrastructure allows, and we can see what the transformation program endeavours to do. It's aspirational, and that's great. I think that there's an element here about being honest about the need for some really, it's not innovative, but it feels like it is, by saying we should be teaching and training our young people and our staff about mindfulness, about relaxation techniques, about self-care tips, about resilience. These should all be part of the fabric of what everybody should be exposed to in order to look after themselves. I think the system clearly is overloaded. The quality of that experience, from what young people are saying, is interesting in terms of how they perceived it. So we really do need to be honest about the fact that those basics need to be integrated in how we do everything that we do. I need support with self-care. I'm not good at looking after myself. I think all the adults here work themselves to within an inch of what's reasonable. So it's about us all collectively saying, how are we going to make sure this is distilled and cascaded into educational institutions, in the colleges with the young adults, and further and on a deeper level as an educational strategy throughout our schools settings. I think it's deeper work that we have to do, because we know demand is not being met. We know that the waiting times are not being, are really challenging, and we know that the experience is variable. And I think the other bit of that is about data that concerns me is when we recognise, and the young people also referred to this from the Youth Council, that young people from deprived, disadvantaged areas and those with protected characteristics are less likely to pick up this offer. If I missed it, my apologies, but what are we doing to address that inbuilt deficit of meeting the needs of those that are facing further invisible barriers? Thank you.
Shall I go first, and then colleagues can come in if they'd like to? Invisible barriers. It's a difficult one, I think, because there are so many different strands to that. But in terms of where we target our resource, what we have done is try and focus on those areas where there are poor outcomes, I suppose. So in terms of mental health support teams, then we've provided data into the NHS to say, actually, these are the schools where the outcomes are worst. These are the schools where free school meals take up is highest. These are the schools where we've got higher numbers of children looked after. So some of those risk factors, I suppose, are considered as part of that. I think you're right that there's more targeting we need to do, and part of that is about that ability to target locally. So I was saying before, as a whole system across Lancashire and South Cumbria, it is big, and actually what we need is individual schools and individual communities to be helping to target some of this stuff in the right way and signpost. It was quite encouraging to hear that signposting is a little better in schools than it was, but clearly kind of we've got a way to go. It is very much down to the individual school to do that. And I suppose that the comment that was made around Moodle, as an example, so the school's learning platform, so that is for individual schools. We don't have a way of kind of putting something central into that kind of technology. So whatever we do in terms of getting the message out, it is very much kind of working with communities and working with individual schools and colleges and settings to do that. So I suppose in some ways I would turn it round to an ask of counsellors and colleagues to help with that, and actually where you see something where you think you can make a difference locally, then let's try and work together on that and see if we can do some good.
Is that okay, Sylvia?
I would just ask for something a little bit more forensic in terms of targeted work with deprived areas, and I think that should be an intervention that should be built into the work that you do. If we know the uptake isn't there, this is the only way to ensure equity, and I think this is what you should be reflecting in how you do what you do. It's about process. Please integrate it into process so we get the outcomes for the most vulnerable as well as less vulnerable children. Thank you very much.
Chair, might I come in there? It's Blair Carney. Thank you, Councillor. I guess that's our challenge, and it's a really helpful challenge, I have to say. I think from my perspective, and I refer to the system, we are very reactive. We're trying to support and react to the current situation, and we're not necessarily that good. And we have to put our hands up to say we're not that good at prevention. And I think what you're suggesting there is understanding where the need is and doing some of that work to support prevention. As we move forward, we've got a new board that's being set up, which will include our education colleagues, local authority colleagues, and also our population health management teams to support some of that real forensic, as you suggested, understanding of what the needs are, where they are, and then the task for us in that group is then to work through the so what. So even if we have that information, it's what do we do to make sure that we link to those groups, that we target the money in the right place, that, you know, all of those things that you're suggesting. It's the start of our journey, I would say, and I'm really being, you know, quite honest with you, but absolutely accepting that that's a challenge for us, and I'm anticipating that it's the start of our journey, and that the transformation agenda will start to pick up some of those things and really target some of those population groups and areas that you've challenged us with.
I would welcome you coming back to feed us to provide feedback on what that targeted work looks like. And I'm very grateful to you for your honesty, and thank you for taking it in good faith, my diatribe, as it were.
Councillor John Singleton, please.
Thank you, Chair. Just got three brief questions, and it refers to the papers. First of all, on page 13, where we talk about rolling 12-month position, and it's good to know we're hitting 79% on 4-week referrals. But can the officers tell us of the other 21%, what's the longest waiting time? That's number one. Question number two is on page 18, and that's regarding the eating disorder services, and we seem to be missing some actual metrics from August 21. Can we explain that? And the third question is on page 23, and that is regarding just for clarity, on the timeline training, there's no start and completes, no dates at all. So I'm assuming that we are up to programme. Can we just confirm that, please?
Thank you, Councillor. So in terms of the current waiting times, I don't have that to hand, Councillor, but we can certainly feed that back in to ensure that colleagues are aware of what's the longest waiting time that our children and young people are waiting. With regards to the data missing, that's just that no referrals were received in that particular month in that particular area. So it's not missing. It's just a blank in terms of the data. So we could have put a 0, I guess, in terms of no referrals received, but that's the reason for the data. And then just in terms of the mental health in schools teams, there are 2 intakes. We're absolutely on track. So there are 2 intakes across the year, one that starts in September, October, depending on the establishment, and a further one that starts in January. So we have 2 cohorts per year. We're on track with all of those in terms of the start dates and the end dates, and the trainings for a year. So they come out at different times of the year, but absolutely on track. There's no issues with that, Councillor.
Fine, thank you.
Councillor Jenny Main.
Yeah, thanks, Chair. Yeah, I mean, we've been given masses and masses of information here, and it is hard to take it all in. But I do, you know, I thank the presenters, because actually, you know, we're all very, very busy people. It's good to get it. It's really, you know, it's made this morning very worthwhile. I think the young people's presentations is the most telling of all, and I have to agree with Sobia. We've been hearing this well, I've been hearing it for almost 20 years. The same problems, the same shortcomings, the same, you know, unable to access services, same long waiting times. Please, 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 this time, is it going to change? Just on the young people's presentation, well, not their presentation, but the access to the services, digital access, you know, how satisfactory is that? You know, do young people go online? Young people who are, let's face it, often in crisis, do they go online and receive any kind of help or counselling that is useful to them? I'm thinking about the chat health. I can't imagine anybody, any young person who's really suffering emotionally, thinking about self-harming and wanting to message somebody and get a message back. I mean, I might just be being old here, and maybe young people do like that kind of thing and can identify with it. A couple of the other things, the MHST teams, you're hoping to have, I've forgotten what the number is now, by 2023-24, but it's not very many, considering we've got something like 600 schools. How many schools is each team going to be working with, and how was the actual timeline devised, or the order of people being trained? Because, you know, somebody pointed out the discrepancies in referrals and the waits in different parts of the county, and there is going to be a discrepancy in the waits for people to actually have access to these teams. And I wonder how that timeline was designed. And just another minor thing, on the transformation phase, one of the lines says, development of a crisis, risk support and home treatment offer at place. You know, what is place in this context? And I do hope that the 0800 number on the 24-hour line is manned appropriately and people aren't ringing up and having to wait for hours, because it won't happen. We'll do something else instead.
Thanks, Chair. Shall I take some of those points and then hand over to colleagues? So I think your last point, Councillor, with regards to the crisis line, we receive data on a monthly basis which details how many people phone and how quickly the telephone is answered, and then how many people who did phone then don't have an answer. So we monitor that on a regular basis. So it's not just a line that's manned. We do monitor that. It's absolutely manned by trained staff. So as required, they receive the phone call and can support the person on the other end of the telephone and signpost, support, send out a team if required. So there are various options once somebody phones that line. With regards to the mental health in schools team, David, do you want to pick up the issue with regards to the current provision and estimated schools and things, please?
Yeah, thanks, Blair. Thanks for the question. I will have to go shortly, so it's great that I've been able to kind of come back in and talk about MHSTs and have it recognised. So all the teams are allocated in a fair share basis, which is where we're at, to 45% across. That it's 40 to 45% across the country by the end of 23-24. So as you can see in how we try to allocate it for Lancashire and South Cumbria is to get as many teams as early as possible to get the teams running and moving forward. We're really hopeful that further teams may come on board before the end of 23-24, but the expectation is that further teams will come on board after that time frame. As you can imagine, it is a national programme to create this brand new workforce. There's limitations to how many people we can train, but the main limitations is making sure it works, making sure it moves forward in the correct direction, but also making sure there's time in place for recognition of what each locality needs and recognising their school's needs so that it comes on board in a proactive way. And I think, you know, as so many people have said today, and I know I've worked in mental health for over 30 years as a practitioner, and I think as a mental health nurse, what I've seen is just the essential need for a greater understanding around mental health. And it feels like in the last couple of years, we have moved in such a big way to be able to start to recognise and work with children to understand and recognise their own mental health requirements. And I think that is the way forward. And I think just see great things around MHSTs across the board, and the feedback is quite amazing. I definitely hope that we'll be able to move things faster at any time. And I do hope, and I'm 100% positive really, that we will continue to develop and expand the MHSTs as they go forward. I'm being pulled into my other meeting now, so that's the noise that you can hear in the background, sorry. But I hope that helps deal with that question, and I'm sure Flo will be able to deal with anything else. Apologies, I can't stay any longer, but thank you very much for today, and I look forward to hearing all of the minutes from today. Thank you.
Dave, just before you go,
yeah.
I don't want you to go quite yet. Could you send me some information on the mental health support teams where you've got Blackburn, Darwin and Morecambe Bay and East Lancs? They have done the full year, and now they've done the training the first year to 21. They've now done it to January. They will have done, so they will have done the first year. I want to know what the outcomes are from that, please. So if you want to email it, and I can deliver it to the group at the next meeting, but these people now coming up the first 3 boxes will have all done the first deliverance. They've done the training, they've delivered. I'd like to know what the outcomes have been from that before we start on the next section. Wye will be up in, Faldon Way and Blackpool will be up in September 22. So I'd like to, if you could do that, because I know you're rushing, so I'm not putting you on the spot, but if you could get an email to me so I can deliver that to my members, that'd be great.
Sure.
Thank you.
I'd be more than happy to. Thank you. I'm sorry I have to leave, but thank you.
Also, while we're just on this, can I just ask Fleur, you know the crisis line, who's it manned by? Are they paid staff, volunteered staff?
No, they're paid trained staff, Chair.
Right. And the other thing was, when we're talking about giving information out to schools, I think it would be good if we have a screenshot for children and young people, so they can screenshot on the phone, so there should be things up available. I think it's about 2 or 3 years ago, took to full council about having a sign for suicide and other services on the back of toilets. So if you went in the toilet, everything was on the back. I don't know how many schools took that up, but I know we did in Wye because I went to every toilet to have a look. So for councillors, we could maybe do that and put this on the crisis line number. So a young person just thinks, I'm having bad thoughts today, I'm going to take that number, I'm going to do that screenshot or whatever it is, and then they've always got it in the phones, because I would think there'd be 99% or more would have a phone and would be able to put that information. So I just wanted to bring that up so while we're here. Thank you. off with John. Have you got anything you want to ask?
Andrew, I don't think people have completely answered my queries. And even, I understand the calls to the crisis line are going to be monitored. What's the unacceptable wait time? Because there must be one. But I don't know what place is either.
Sorry, Councillor. So I think that's why we changed the slides, just to make sure that it was understandable and that the takeaway messages were easily readable. But place means we as a system, we have 5 areas or 5 integrated care partnerships, and that just refers to a local area councillor.
Okay, that's fine. So it's one of the 5 ICSs or ICPs?
ICPs. So we've got Morecambe Bay, Pennine Lancashire, Fylde Coast, Central Lancashire and West Lancashire of the 5.
Right, John, have you got a question?
My main question is, how many of the staff are trained in BSL, which is British Sign Language? I speak this from a personal reason, as my daughter, my oldest one, is profoundly deaf. And when it came to mental health issues, because she abused brothers, sisters, parents, staff, teachers at school, there was no one there who could sign to her and help her. So how many staff do you have that do sign language?
Thank you, Councillor. I'm sorry I can't give you that information. I'd have to go back to our various providers of mental health provision to ask them. I can't give you that data today.
Who's got Stuart? Have you got any questions?
Yeah, I just wanted to ask about the, we had in the past young, boys were falling in education. We now see that, Year 9 girls who've got free school meals are more likely to hardly never feel happy. So I wanted to know what the action plan was for that. As the other commentator said, what forensic analysis have you already done, what you're going to target. Second question is, I'm really pleased to hear from young people about having a quiet time at midday. And also, I think in terms of mental health, I think if you know somebody that's been through a similar experience and they're the same sort of age group as you, that would help. So in terms of the peer support, what are we doing in terms of allowing schools to develop their own program with, mental health, counsellors, or champions, as you might call them, so people they can relate to. It might not be a teacher, it might not be appropriate for that. It could be a form tutor, it could be another student, So how are we sort of getting the schools, as you said earlier, to run their own things locally and get the support they need from the NHS when it's required?
So kick off. So how we're going to target the data that I've shared with you today is really new. So we got that for the first time about 3 weeks ago, and I wouldn't want counsellors to look at that in isolation. It was a snapshot. So actually there are other areas, I think, in the system as well, where if you pulled some data out, you would say actually there is something around colleges and the support that we give. So it's different parts. In terms of what we do with it, though, we certainly do use that information to target our resources and our efforts. So in terms of the allocation of resource, for example, in early help around the system, then that will be based on some of that data and the information intelligence that we've got. I think there's also an opportunity to use that data across our wider partnerships. So one of the things that we've started to do is share that information through our Children and Families Partnership, so not specifically around mental health, but actually that is then talking to the police, it's talking to schools, it's talking to colleges, and a whole range of partners. So actually we all start to see some of these challenges as whole system challenges rather than something that is for one bit of the system. In terms of the point on peer support, then we had some Wellbeing for Education return funding through DFE last year, and part of that funding was used in primary to develop some peer support programs. I haven't seen the evaluation of that, but I believe it's quite positive. So where we have opportunities to do things like peer support programs, then we will do. The challenge, I think, in terms of some of those things is sustainability. So we tend to get one-off pockets of funding, and that will either lead to a service which is commissioned by the county council or by individual schools. When that funding disappears, then sometimes that kind of peer support network starts to wither as well. And I think that's why some of the workforce stuff that Marie was talking about in terms of whole school approaches is so important, because it's not necessarily about buying a commissioned service, it's actually about using the networks and opportunities that you've got within the schools and colleges to do some of that work.
Matthew Slater.
Thank you, Chairman. I haven't particularly indicated to speak. I think what I would say is I have been encouraged largely by the information that we've had. One thing that I suppose did strike me on right at the very start was in terms of the national access rates target, we're doing substantially above the national target, which is seemingly 20%, which is very strikes me as very low, and we're hitting 55%, which is very encouraging. Why are we able to do that? But also, you know, is that really enough, and are we resting on our laurels? So that was just a quick one off the top of my head. I'm also interested, I know it's been said that we will have circulated a bit more detailed information in terms of the next page, and in terms of the breakdown of information about the students who responded to the survey about how happy they are, and I think that would be useful. I notice, as has been mentioned, that there seems to be an issue, for instance, that girls were saying that they were less likely to be happy. I wonder whether that's to do with issues of putting pressure on themselves, or sort of issues with peers and that their self-esteem issues, that sort of stuff. That would be interesting to hear about it, and perhaps when information is circulated about impacts of you know, issues with ethnic backgrounds or all sorts, that if we could have a little bit of information perhaps on why some of these things are going wrong, and we need to think about why you know, certain groups of students are perhaps particularly struggling, and how they can be supported. So yeah, that's just
Shall I take the access point, Councillor? So you're absolutely right. We are achieving higher than, and I think I referred to it earlier, what we as a system don't want to do is hit the target and miss the point. So, you know, there's a lot of stuff behind that, and we absolutely are not sitting back on our laurels from a health perspective to ensure that these children and young people are seen quickly by the right people in the right environment, which I think, as described, could be a multiple of different modes. So, you know, absolutely not. We're not accepting that we've achieved 50%. Is that good enough? No, it's not. We are continuing to strive to do better. I guess is in terms of the how, there'll be multiple reasons as to how we delivered what we've delivered. From a previous role, There are a number of issues with regards to data collection, which isn't helpful. So it's not necessarily related to the number of children that are seen. It could be a data issue. I think we're very clean on our data and are really representative in terms of what we're doing and how we're delivering. There's a constant review of pathways to ensure that we are delivering the right service. So as I said, for me, it's more about the outcomes rather than the target. So we have regular meetings with our providers to make sure that we are linking with our children, young people, that we're delivering the outcomes that we set out to, and not just achieving that target, Councillor.
Councillor Sue Hind.
Thank you, Chairman. Not really a question, but a comment. A colleague said earlier that some primary school children have problems with obesity, and we all hate that particular description. But primary schools only have children for about 2 nights of their time, normally. So I'm not quite sure as a county council how we can deal with that problem, because it starts at home. Just a comment. Thank you.
Rita Khan.
Thank you, Chair. I've just got a couple of questions, and I think the first one is around the service demand. In page 16, it mentions that interventions are required, complex interventions for referrals. And I just wanted to know, because I couldn't find anywhere in the information whether there is, and I'm sure there is, some monitoring and data collection around knowing what these complex interventions are. What are they? Is it around anxiety? Is it around depression? So is that something that you're collecting and you'll be able to give us in the future, especially around the different districts and the areas where there may be a specific issue or a complex situation that's taking place? That's the first question. And my second one is around, I just wanted to know who the VCFSC partners are. Do they vary from area to area? Or are they particular organisations that, you know, play a key role within children's services? Thank you.
Thanks, Councillor. Shall I take that one, Chair? So in terms of the VSCFE, there are national players in that and also local players. We recognise that there are lots of local charities in each of our areas that are supporting us deliver what we need to deliver in terms of services. We're just in the process of reaching out again to our voluntary care sector to make sure that it's equal in terms of ability to support us in our journey. So it's very inclusive, Councillor, rather than exclusive. In terms of the access, gosh, let me just think. What was the question? So, apologies.
And knowing what the complex interventions were required for.
Yeah. So again, from our perspective, we have quite a lot of data as to what happens next. So it's not just about that referral. It's the referral to treatment. So what treatment did they receive? What were the outcomes of that treatment? So there's a lot of data that's being collected that we can certainly share if there's a specific piece of information that you require. I have to say that from a national perspective, we've got a national data set which we all have to complete. It's not that great in terms of outcomes, and so we're trying to pick those up ourselves to make sure that we are delivering the right service rather than the tick box exercise. But the national team have recognised that, and the data set that everybody has to complete as they see a patient will start to include some of that outcome data. So it will be much richer in terms of data available to us and being able to challenge and check that the service delivery is that's delivering the right outcomes, Councillor. I hope that answers your question.
Yes, thank you.
Councillor Terry Hearn, have you got any questions?
Thank you, Chair. Yeah, as we know, mental health is a very complex issue. but not everybody with mental health is aware that they need help. Is that built into the system to recognise this?
I think there's quite a lot of work going on at the moment around raising the profile for people to be able to support others around mental health awareness, so reducing stigma, etc. And I think that it's just about sometimes about opening up a conversation when people feel like they need help and support. And that's part of that Fleur mentioned before about that early intervention, prevention kind of conversation that can take place, particularly in schools, which is what we've got to focus on at the moment. So I take your point, but it's kind of for those people to reach out and have a conversation. And it doesn't have to be kind of, I have a mental health issue. It could be, I'm just struggling at the moment, and it can, and that's where we're trying to look for that support to be. So that's with regards to the mental health support teams, with regards to the staff, and with regards to communities widely as well. Thank you.
Councillor Stephen Clark.
Thank you, Chair. This is more of an observation which I've actually seen from CAMS, and which related actually to my own family. And from the CAMS actually being involved to actually trying to get some treatment sorted out, the member actually of the family ended up actually had to be sectioned. It took that long for CAMS to sort things out. She ended up trying to actually commit suicide and ended up in an establishment near Ormskirk because she was so serious. And I'm just so glad to see that Times seems to be actually making the referrals a lot quicker, and I just hope that carries on, because you cannot ever get to the state where people are risking taking their lives before they get treatment. Thank you.
Can I just say to you, is there anything on behalf of corporate parenting, because you represent our children in care, do you think this is great? Do you think they could come back to us, some of them, with how they feel about how to contact people in their hour of need and services?
Yeah, definitely on that one. We need actually to make sure that people know where to go and how to get help quickly. And I think through the Corporate Parenting Board, we are going to have to set something up where everybody who's in care knows the way forward. Thank you.
Now, starting with our young people. Georgia, is there anything you'd like to say?
Just a few questions. With the referral times earlier, I don't know if I'm getting confused or if you haven't actually answered this. In reference to CAMS, how long is the average waiting time across Lancashire? With the eating disorder services, on the sheet it doesn't actually give you a breakdown on what eating disorders people are being referred for. It's just kind of saying these many people are being referred for eating disorder because of symptoms of eating disorders. So do you have a breakdown on like which eating disorders they're being referred for, because there's more than just anorexia and bulimia, as we know? With the crisis line that you were on about earlier, I think, do you have any sort of data on the quality of care and support people are getting with that, as well as just across services in general? Because it's all well and good saying we are reaching this many people, but which obviously is, if you're reaching the people that need the help, then that's good. But if they're not receiving the quality of care, then it's kind of redundant then, isn't it? And then with anorexia as an eating disorder, from my understanding, in order to be diagnosed with anorexia, you have to be at a BMI of 18.5. Correct me if I'm wrong. Is this kind of like an outdated sort of like way of diagnosing people, or should we be diagnosing people on behaviours and like thought patterns instead of weight, if that makes sense?
Thank you. They're really, really helpful and challenging questions. So with regards to the eating disorders, you're absolutely right. There are various types of eating disorder. I can't say honestly if I'm sure they do, but we can certainly come back to you to identify the outcomes in terms of which service they they get referred into. I know that we have a couple of experts that pick up particular elements of the eating disorder pathway, but I haven't got that data to hand. With regards to the crisis line, it's really, I suppose, it's really difficult to monitor the outcomes. So what we monitor is how many calls we get, and then where the caller is referred on to. What we haven't necessarily done yet is then triangulate it with the so what. So I think that's a really interesting and challenging question for us to think about. If we, we're providing all these services, we think we're doing okay, but actually are we? I can't tell you that at this moment in time. So I think that's a real challenge for us to think about the so what of that crisis line. And then with regards to the anorexia, you're absolutely right. There are some very set criteria with regards to a diagnosis. I'm challenging that because I think it's not just about the BMI, it has to be about all of those other things that you suggested. And my concern is that we wait too long for the patient to be at a certain level with regards to their BMI before we then start to intervene and treat. So my challenge back to our organisation that supports the eating disorder services, what's the preventative, what's the intervention at an earlier stage, so that we don't end up in a position, as you suggested, where our patients are so unwell that they then potentially need an admission to hospital. So I guess that they're in progress, but I have written down absolutely the so what of the crisis line. So thank you, really helpful.
I have more of a general question, and it's a point that was made before actually. We've had 3 councillors speak now about issues which were brought up 20 years ago, about people in the education system who've noted these issues. And the member for NHS Flight and Wire said they admitted that the NHS, it's a very brave thing to do, is a reactive organisation, which most government structures are. Is there anything bar the new agenda which was mentioned that is being done to change this attitude of that the cure is far better than the prevention, when by all means we're wasting far more money and resources curing things that could be prevented? Thank you.
Thank you. Again, another interesting challenge for us. I think from a health perspective, in terms of the mental health in schools teams, that is, for us, it's probably a very big step in addressing some of those issues that have been around a long time. That schools team also offers support to our teachers and to the staff within schools. So I think that's our first step in probably addressing some of those concerns that have been around for a long time. Individual schools have their own ways of dealing with things, which I can't comment as to whether or not they are, they do well. I think the other thing to say is again, we've been, unfortunately, we've had a couple of deaths by suicide of young people, and that for us has highlighted some particular gaps in the provision, both from a school's perspective, but also what's the response. So we're working on that basis. We've got some very clear learning from that in terms of, as a collective, so that includes our local authority colleagues, plus health, our voluntary care sector, what can we do differently in response to some of these crises that we're seeing within our children and young people. So I guess the answer to your question is, we have learned. We are trying to support some different ways of working, and this is one of them. But there's still a very long way to go. We're, as I said before, we're on the start of the journey, and my challenge to us as a team is to make sure that we revisit the objectives, we revisit the transformation programme, to make sure that what we're delivering is the right thing. So, as an example, we wrote a 3-year plan, which is in year 2. But my view is actually we don't just go with year 3 because it may not be the right thing to do now. So we go back and revisit that to make sure that we've got the priorities right, in line with our demand and in line with the focus that we need to have across our system.
Marianne?
Thank you. I think my question was brushed upon slightly, but I was just wondering what was being done in regards to combating the stigma surrounding mental health, and if there's anything being done to normalise like the talking of feelings in order to prevent mental health issues from developing.
Thank you. I think there's I mean, you'll see Alex, I think his name is Dr. Alex, who was on Love Island, is now our ambassador for mental health from a national perspective. So I think there's a lot being done nationally, absolutely recognising that there still is stigma. People, in certain age groups and certain sexes and certain ethnicity don't talk about it. They won't talk about it, and they don't want to talk about how they feel. There is a lot being done around that, but it's not enough. We still see our population group with very acute anxiety presenting in our services, which, had they been supported a bit earlier on with the right treatment, could have been prevented. So no, there isn't enough being done, but we're certainly working on making sure that where we know there are gaps, we are working with our population groups to try and to I suppose fill some of those gaps. But it's a long journey. It feels to be that we've still got an awful lot to do, recognising the stigma, the acuity of some of the patients that we now see, and also from my perspective, it's making sure that we pick up some of those traumatic things at an early age. So the schools teams will help us do that, because what we know is that those people that if we can help people earlier, so as children and young people, we hope that there won't be then such an acute need as they get older, because we've supported them in a lot earlier stage, I guess. But yeah, my answer is no. We're not doing enough. There's still a lot to do.
I'd just like to bring Marie in. She wants to speak.
Hi, yeah, just going back to your point around stigma, I think it's something that we need to overcome as a system. So we've talked today about the whole school approach, we've talked about systems, we've talked about collaboration and communication, and basically that's where stigma comes in. We need people to open up, have a conversation, just say, I'm not having a good day. So we've done some things within partners with the Lancashire South Cumbria with regards to having things such as the orange button. So people have had mental health awareness training and suicide awareness training, and basically you wear an orange button and it says that people are approachable. It's about us trying to get that out there, and we've had conversations already about what we could do for young people and if we think that would work. And that goes back as well to the thing around the peer support, having people in place at the right time, whether it's your senior mental health lead, whether it's your mental health school support team. We are trying to develop a system. As Blair said, we're certainly not there yet, but I think it's credit that we're all sat around here talking about it, which then means, it's a great attendance and we're all interested and we're having the conversation. So we're doing quite a lot of work around suicide awareness and mental health, and having people opening up conversations. I think it'd be really interesting to come back to you guys as a youth council at some point and see how we could open up those conversations and make it more beneficial, how that people can reach out for help. So that's possibly something we could go back to at some point. Thank you.
May Reid.
On the slide about eating disorders, it shows the disparities between male and female referrals. Do you think that data is representative on the pressure on girls and their appearance and kind of lacking self-esteem, or is it a failure to recognise and pick up on boys with eating disorders?
Thank you. So that referral data is those patients, children, young people that are referred. So I suppose it's based on who is seen and then referred. So I don't think it's necessarily that we're not supporting the male population. It's the female population that we've seen an increase in referrals into that service. But we would treat male or female.
Amber.
First, before I ask the question, the posters that you were talking about that are up on the toilets, they also have QR codes on, which is like really helpful. Like personally, I haven't needed to use a poster, but I've seen it and it's stuck into my head. So that's also somewhere I can go if I needed the help. But my question is, why do young people have to wait until their eating disorders are serious enough to be seen to? Like, do you not think it'd be better if early intervention were in place? And why has it taken so long for people to realise that?
Thank you. The challenge, I suppose, and we absolutely recognise that the pathway is designed to pick up, currently designed to pick up those in the most need. We have a limited service, so but we've invested over £500,000 this year as a system into our eating disorder pathway. It's not right. It's not gonna pick up everybody that needs some intervention. So what we're hoping is that those children and young people will have a variety of options to support some of that prevention, whether that be the mental health in school support team, whether that be through the crisis line. But you're absolutely right, and I think as one of your colleagues suggested earlier, it's about a certain criteria before you're then seen by this specialist eating disorder team. And my challenge back to our eating disorder team is that for me isn't good enough. It's picking up the children and young people at a very poor stage in terms of their mental and physical health, and we need to do something much earlier from a preventative perspective, and we need to look at that pathway to make sure that we can pick up children and young people at a lot earlier stage. One of the big limiting factors is that is the workforce. We don't have a huge amount of specialist teams that are available to us, and we've noted across the last year that all of the investment in the world doesn't bring us the people, doesn't bring us the staff. So we're now looking at different ways of supporting and expanding our teams to try and, I suppose, fill some of those workforce gaps. But that doesn't detract from the fact that we've got children and young people that aren't getting the right service.
I think one of the steps forward, we should look together at getting the posters out into the high schools and the colleges with the crisis line number and others. So if we can get somebody to send over the copy of what we previously had put up, all it is a very cheap thing to do. Somebody designs the poster in-house here or with yourselves, and we email it out and ask the schools to print it and put it on the back of every toilet. And then all councillors can check their area and make sure that every child has got some sort of line straight away to go through. So if I could ask for that to be disclosed between you both for you to sort it out. Yeah?
Councillor, there's already conversations taking place about doing something very similar, so I can ask for an update and come back to you. Thank you.
I know it works because it works in my area. And I got the youth council to design it originally in Wyre. What I want to say now is I want to thank you all for today, especially to our guests and presenters, and I wish you a very Merry Christmas, and we look forward to seeing you in the new year. And we just chase up with Dave Keegan that he comes back with my answers so I can pass that on. I want to thank you all, and if I put you on the spot for a question, it's because I know inside you've all got a question. You just don't put your damn hands up for me. So that's why I made you all say something today. Especially thanks to our youth council. Fantastic. Absolutely brilliant. So I want to wish you a Merry Christmas as well, and we always want you to join in and take part because it's so important. Right, moving on. We have to have recommendations. So if you guys want to go and get your dinner now, because I know it's been a long morning, that's great, and we have a good time. And we'll now move on with the rest of the meeting, so I can get you out straight away because I can hear tummies rumbling, especially mine. So we went through this morning service demands, responsive COVID, emotional health in schools and colleges, mental health support teams, transformation phase, plans moving forward. The recommendations. So listening to everything you said, I thought implementing on our contact cards for CYP, children and young people, under mental health services for all councillors, so we know who to contact when we have got somebody in our community that needs that support. We should all have that, as counsellors should all have contact numbers to go forward. Referral information and guidance on all school websites. So we can't make a school put these posters up, we can't make them put it on the website, but maybe ask them, can they do that in support? We're all working together for the better outcomes of our young people. Information on local support for children and young people identified and provided in the schools. Briefing for all counsellors on pathways into children and young people, mental health services. Report to a future meeting on the committees to include information on impact and outcomes. We may also want to consider a further scrutiny inquiry session day. That's where we can get right down and ask all the things and offload everything that we want to talk about, because lots of people message me and say, this is happening or I'm not happening, I don't like that. Well, let's get together and have a day where we can sort it out. So we're going to have a scrutiny inquiry session, if that's okay with yourselves. We want to review our youth services and youth council groups in all districts with a view to understanding how to increase participation, more effective utilisation and better communications with schools. Review of local partnership groups to support early intervention services. Review of availability and accessibility of information to schools on resources available to support early intervention. And the feedback from Blackburn, East Lancs, Morecambe Bay and Blackpool Fylde and Wyre on the MHST. So we know that is the mental health support teams. So we've asked Dave to come back, and that's crucial. Now this inquiry day could be February or March. Are you all happy, members, that that is the referral we're going to take? And we want to do that because we want to get down to the bottom of it all and offload everything that's upsetting you, worrying you in your area. Let's put it cards on the table. Let's have it out. Now, any questions on that? Are you all agreed? Thank goodness for that. Item 5, the work programme. We've got children's health situation update post-COVID and update on children looked after to include housing, EET and transitions. Are you okay with those? Nothing wants to change? And then I have got anything else you want to put on the work programme? Or are you happy to go into the new year with the start, and then we'll see where we are after we've had our inquiry day? There's no urgent business. The only business we've got is the next meeting is Tuesday the 18th of January 2022. The meeting starts at 10:30, but at 9:30 I would like you to be present. That would be lovely. So I don't have to come and find you. You're all here to start. Have a fantastic Christmas. Get a good safety home. I'll see you in the new year. Thank you.